Good afternoon, everyone, and welcome to today's COVID-19 update. As always, we have Dr. Dina Hinshaw, Chief Medical Officer of Health for Alberta. Dr. Hinshaw.
Thank you, Chris, and good afternoon, everyone. I want to begin today by thanking everyone who participated in last night's telephone town hall on COVID-19 vaccines, pregnancy, and fertility. It was great to see strong engagement and thoughtful questions from participants, and I appreciated the expertise my medical colleagues Dr. Corrett and Dr. Castillo shared in response. A recording of last night's town hall is now available at alberta.ca/townhall. We are also developing additional resources based on the important questions we received last night, and those will be posted next week. If you or someone you know is pregnant, trying to become pregnant, or has recently given birth, and has questions or concerns about COVID-19 vaccines, please review the information available on alberta.ca or speak to a physician. The risk of severe outcomes from COVID-19 infection in pregnant women has increased, with variants of concern, including the Delta variant that is now the dominant strain in Alberta. Vaccination against COVID-19 is the best way to protect both parent and child from the virus and the long-lasting side effects it can cause. I'd like to remind Albertans that vaccine hesitancy can be very complex, and we know that fear and uncertainty are major drivers of it. To help address this, it's critical that people seek accurate information from trusted, expert sources to make the best informed decision that they can. It's just as important that vaccine-hesitant individuals are treated with compassion and understanding as they go through that decision-making process. If there is someone in your life going through this, I encourage you to reach out and offer supports to help connect them with reliable resources. Turning to today's numbers, over the last 24 hours, we identified 531 new cases of COVID-19 and completed about 10,200 tests. Our positivity rate was about 5.4%. There are currently active alerts or outbreaks in 245 schools. Of these, 3 schools had 10 or more COVID cases who attended in the last 14 days while infectious. We continue to see a slow and steady decline in hospitalizations, and there are currently 779 people in hospital, including 185 in the ICU. Sadly, I must announce that 12 new deaths were reported to Alberta Health in the last 24 hours. I extend my condolences to those mourning the passing of these people and to anyone who has recently lost someone they cared about, no matter the cause. You are not alone, and there are supports to help you during this difficult time. While we are still dealing with the 4th wave, there are joyful moments in our lives. I know that Halloween is a favorite time of year for many young and young-at-heart Albertans. As we head into the weekend and trick-or-treaters put the final touches on their costumes, I ask everyone to follow these basic measures to celebrate safely. First, if you are feeling even slightly unwell, you need to stay at home and you should not hand out candy. As disappointing as it may be to miss out, staying home when we have symptoms, even minor ones, is extremely important. If you are going trick-or-treating, only go with members of your household. Be sure to wear a non-medical mask and sanitize your hands often. If you're handing out candy, please look for ways to limit contact with others. That may mean setting treats out outside, spaced apart for contactless pickup, or using tongs to hand them out while wearing a mask. If you're planning to gather with anyone outside your household, you're legally required to follow the private social gathering restrictions that are in place. This means no indoor private social gatherings for adults who are not fully immunized, and indoor gatherings for those who are fully immunized are limited to up to 10 people with no more than 2 households. If you're gathering in person, holding it outdoors is the lower risk option. Just be sure there are no more than 20 people in attendance and that there is 2 meters of distancing between members of different households. These simple precautions can be very effective at limiting the spread of COVID-19 if we all do our part. We've shown they work time and time again. Let's make good choices to ensure there's no Halloween spike in 2 weeks from now. Finally, I want to thank Albertans for continuing to drive cases down by following public health measures and getting fully vaccinated. The last month has shown us just how powerful that combination is. I also want to remind Albertans that free influenza shots are available to anyone 6 months of age and older. If you haven't yet received your flu shot, please do so as soon as you can. Appointments are available through the online Alberta vaccine booking system or by contacting your local pharmacy directly. If you still need to get a COVID vaccine dose, you can get your COVID vaccine at the same time to protect you from both viruses. Thank you, and I will now take questions.
Thank you, Dr. Hinshaw. We do not have any media here in the room in Edmonton today, so we will be going straight to the phone lines. Operator, can you put through the first caller, please?
Jason Herring, Calgary Herald.
Hi, good afternoon, Dr. Hinshaw. I understand that Alberta is now releasing some of the federal resources it had received in order to deal with the fourth wave in hospitals. Wondering if you can provide any details on that.
I don't have direct involvement in the decisions around acute care management and staffing of acute care. So again, it's my understanding that as the impact on acute care goes down, that Alberta Health Services is working in an ongoing way to make sure that resources are deployed where they're needed to provide care to Albertans, not just for COVID, but other health conditions. But specific questions around exactly what those resources are, where they come from, would be best directed to Alberta Health Services.
Jason, do you have a follow-up?
All right, yeah, that sounds good. On a different topic, there does continue to be a disproportionately high number of cases and a high positivity rate in the north and central zones, and there's some problems in hospitals in the area, including at Rocky Mountain Hospital, which has paused acute care admissions due to an outbreak. Immunization rates are also well below provincial averages in a lot of these communities. What's the province doing to, boost those immunization rates so that we don't see these areas perhaps prolong the pandemic?
We have been working for a long time and certainly redoubling our efforts to work with partners on ensuring people have access to reliable information about vaccines, working with different opinion leaders, working on information products to ensure that Albertans have, again, access to information. There's different communications products that are being developed in partnership with different groups of Albertans across the province who have messages that are, again, making sure that Albertans can see somebody that's similar to them, someone that they may trust a message from, making sure that we're using and collaborating closely with all available partners to really get the message out of how important vaccines are. And as we have been doing, again, for many months, redoubling our efforts in ensuring that there's availability of vaccine, and that's through pharmacies. There's vaccine still available in some participating physicians' offices, working with the mobile vaccine delivery bus to provide opportunities for additional vaccine close to home, and continually looking to get input from local partners, whether that's at the municipal level or other partners if they have specific ideas of what could help in their community. But ultimately, it really is just, again, continuing to provide the opportunity, continuing to provide the information, and working as much as possible with partners so that there's a range of voices that can emphasize the message about how important vaccinations are.
Operator, please put through the next caller.
David Staples, Edmonton Journal.
Hi, Dr. Hinshaw. In late September, the Canadian and Alberta Medical Association were calling for fairly strict restrictions put in. They called it a fire break lockdown. That would have included both restrictions on the unvaccinated and far more on the fully vaccinated. The Alberta government didn't go in that direction, yet we see case counts crashing right now from an average of about 1,600 a week or 1,600 per day to about fewer than 600 per day. Why has it, without that fire break, why do you think case counts have been dropping so much in Alberta?
There are two things that impact the transmission rate in the province. One is our vaccination rate, and the other is the overall number of transmission events where someone who's susceptible is exposed to someone who's infectious. And that second piece is heavily influenced by how many people are in contact with others outside their household every day, how many of those in-person interactions happen. As you know, we put in measures on September 20th that significantly reduced the number of in-person interactions happening in many different venues. And the restriction exemption program, which did two things. First of all, it provided additional incentive for people who may have been willing to be vaccinated but just hadn't gotten around to it yet to go and access the protection that vaccines offer. So that increases that vaccination coverage, and it also creates opportunities so that those spaces covered by proof of vaccination for participating venues, that those spaces now have the people in person who are much more likely to be protected. Again, the people who aren't vaccinated can provide proof of a recent negative test, which lowers the likelihood of an infectious person attending, doesn't eliminate it, but lowers it. So I think the combination of reducing the number of in-person interactions that happened, as well as increasing vaccination rates, have provided a combination that has reduced our cases, reduced transmission, and is slowly reducing acute care impact. But I do want to emphasize that we continue to have a high acute care burden. So we do need to continue all of those things, continue increasing vaccination coverage, and continue reducing our in-person interactions so that we can get our acute care system out of this difficult spot.
David, do you have a follow-up?
Yes, the NDP right now is calling for a full review of COVID policy, including how the fourth wave happened, what went right and wrong. And the Kenney government is rejecting that, saying this kind of review should come later after the crisis is over. I'm just wondering if we're not going to have that review right now, if you might be open. I know Albertans have a lot of questions themselves, not just the media, but Albertans have questions. If you might be open to something like going on Facebook for a couple nights in a row even and answering questions from Albertans as you've done in the past.
Certainly, that's something I could talk to our communications team about. I think the important thing for Albertans to know is that it's very clear, and I think I've been clear about this over the past couple of months, that I felt that I was making the best recommendation at the time in early summer to move towards an endemic approach, that it was too early. And so I think Albertans probably have a lot of questions about how that happened and what happened after that. I think right now the most important thing is to continue to do the work to get ourselves out of the fourth wave. And I can assure Albertans that the lessons learned in terms of the assessment of timing and making sure that we learn the lessons from certainly the public health recommendations that were put forward, that those messages are clear, and so that eventually we will need to shift to an endemic state, but it will take longer than we had originally anticipated. And it's just really important for Albertans to know that those lessons learned are not dependent on an external review, but that those are things that, of course, we're learning as we go and trying our best, as we have always done, to balance the mitigation of the direct impacts of COVID with the mitigation of the indirect impacts that restrictions can cause.
Operator, please put through the next caller.
Wallace Snowden, CBC.
Hi there. I have a two-part question on enforcement surrounding the vaccine passport program. There are about a dozen restaurants that have faced enforcement action to date this month for failing to comply with this restrictions exemption program. What would you say to those operators that continue to defy these orders about the kind of risk this poses to public health? And what kind of pressure are these rule breakers placing on frontline enforcement?
So to those who are not following the current public health measures, I would say you may think that you don't matter. You may think as a small operator that the choices you make don't make a difference in terms of the overall impact of COVID on the population. But I would say to those operators, you do matter. The actions that you take matter not only because the risk of infection events is greater when those restrictions are not followed, but also it sets a tone that others see. So it's critical that all of us continue to work together to reduce the risk of COVID transmission in the province. Every single person matters and everyone's actions matter. And our ICUs continue to be at extreme capacity. With 185 people in ICUs today for COVID, we continue to sit at about the peak of what we reached in our third wave, where we need to come down from that because, of course, that's just the COVID patients, and there are other patients in ICU as well. So again, I would reinforce that it's critical that we continue to work together to protect our neighbours, and everyone's actions matter.
Wallace, do you have a follow-up?
Sure. A dozen isn't a huge number, but it is fairly significant when you look at, the historical numbers of restaurant enforcement. Is this still being driven by complaints, a complaints-driven enforcement, or is this part of a targeted enforcement push? And on that note, are there any plans to increase those frontline resources for inspectors?
Unfortunately, I don't have the details about enforcement. Enforcement plans, of course, are independent of the ministry in terms of independent actions of executive officers in Alberta Health Services and the actions of law enforcement officials in local law enforcement agencies. So certainly those organizations might have more details about their current framework and what's planned. And again, I'm not sure about resources specifically dedicated to COVID. So again, those organizations would probably be better positioned to talk about that. Again, I would reinforce that making sure that our communities are protected from COVID is everybody's business, and all of us have a role to play. So would ask those who are operating businesses, those who are attending businesses, to just carry that message and make sure that we're all really mindful of the fact that not just for people who need care from COVID, but for those who may be in a car crash and need ICU care, or those who need surgery and need a hospital bed. We need to protect the system, and it takes all of us working together to do that.
Operator, please put through the next caller.
Quinn Oler, Global News.
Dr. Hinshaw, today we're seeing some of our first lab confirmed cases of influenza in our province. What are you expecting after last year having zero?
It's really difficult to predict what will happen this year with influenza. We know that the measures that we used last year against COVID worked extremely well against influenza. As you likely know, we tested more influenza samples than we ever have before, and yet had absolutely no seasonal influenza in the province detected. So this year we do have 3 confirmed cases to date, and we are, of course, rolling out our influenza immunization campaign. So what influenza will look like this year will depend on a few things. One is, of course, we continue to have measures against COVID. As we continue to have significant impact, that should also help to mitigate influenza spread to some extent. The same kinds of things that we're advising for COVID, staying home when sick, washing hands regularly, those things will also help prevent influenza spread. And of course, the more people who step forward to be part of the protection that vaccine offers, the more additional layers of protection we'll have. So it's very difficult to predict at this point. We'll have to watch closely as the season unfolds, and we know that having had no influenza last year, if there are significant transmission events, there could be significant consequences and cases that have an additional impact on the acute care system. But if we all continue to follow these preventive measures, we can protect each other not just from COVID, but also from influenza.
Quinn, do you have a follow-up?
Yeah. We're talking about Halloween coming up. How big is the potential for Halloween to become like a super spreader or spike event, and how concerned are you about that?
Last year, when we were looking at the fall numbers, we saw, of course, an impact from Thanksgiving that seemed to be exacerbated by Halloween and social gatherings. At this time last year, we did not have the same kinds of measures in place that we do this year. So just as it was in our collective hands at Thanksgiving, the same is true of Halloween. And the more that we can, again, encourage everyone around us to be fully immunized, the more we can follow the public health measures in place, the less likely it is that Halloween would be a spike or super spreading event. So we'll, again, do our collective best to protect each other, to protect our neighbors, and to have the same outcome as we're currently seeing from Thanksgiving. We're not seeing that spike, and so we'll aim for that same thing with Halloween.
I believe that's all the questions we have in the queue for now. Operator, can you please confirm?
Yes, there are no further questions in the queue.
Okay, thank you, everyone. That concludes today's COVID-19 Media Avail. Have a good afternoon.